The Nucleus Caudalis dorsal root entry zone procedure, or DREZ, is an operation for patients who have pain that never seems to go away. This type of pain is often called chronic intractable facial pain. The DREZ procedure can be used for a variety of challenging facial pain conditions, including post-herpetic neuralgia, deafferentation pain, anesthesia dolorosa, atypical facial pain, or trigeminal neuropathic pain. When you feel pain from parts of the face and head, the pain signals travel along a pathway to the brain. This is a sensory tract called the sensory trigeminal pathway. In order for you to sense the pain, the signal must travel from your face through 3 landmarks to reach the sensory cortex of the brain. First, the receptors in your skin sense pain and send the signal into the peripheral trigeminal ganglion. From here, the pain signal travels through the trigeminal nucleus caudalis in the brainstem. The signal continues then up to the thalamus in the center of the brain. At this point, the thalamus projects the signal to the sensory part of the brain, and you feel and experience the pain. This surgery targets the dorsal root entry zone of the trigeminal nucleus caudalis at the second part of the circuit. When this pain pathway is blocked with the DREZ procedure, the pain signal cannot reach the brain and interrupts the pain pathway. The goal of the DREZ procedure is to relieve facial pain that is unresponsive to medical treatment and is not appropriate for other types of surgical treatments. Before your surgery, you will receive paperwork with instructions and reminders regarding preparation to make before you have surgery. You'll be given specific instructions on eating, drinking, showering, and any medications you are currently taking. You'll also meet with the anesthesia team where you will undergo basic tests including blood work, EKG, chest x-rays, and review your medical history with the anesthesiologist caring for you on the day of surgery. The Nucleus Caudalis DREZ procedure requires general anesthesia, which means this is done in the operating room with you completely asleep. The anesthesiology team is monitoring you throughout the operation. In addition, our neuromonitoring team will continuously monitor the nerves for strength, sensation, and balance, which are all nearby the nucleus caudalis, to perform the procedure as safely as possible. We perform the procedure in a minimally invasive fashion using a small endoscope to directly visualize the target and a small needle to make a focused and targeted lesion. To do this, the lower part of the head is shaved and an incision will be made on the back of the neck in the midline for the endoscope and a second small incision for the radiofrequency needle. You will be placed prone in a Mayfield head holder. An incision is made in the back of the neck and a very small window is made to approach the nucleus caudalis. The covering of the brain, called the dura, is open so that the endoscope can be inserted to visualize the surface of the brain and brainstem. The surgeon locates the nucleus caudalis using image guidance to ensure the appropriate part of the trigeminal nucleus is being targeted. It is performed with a radiofrequency electrode. The location is confirmed through neuromonitoring. The goal of the lesion is to interrupt the transmission of pain without causing any facial numbness. Closure is done by suturing the dura and layers of muscle back together. The operation lasts approximately 3 to 5 hours. Once the surgery is complete, you'll be transferred to the recovery room and be closely monitored by the neurosurgical team and specially trained nurses. Patients will typically spend 1 to 2 days in the hospital post-operatively. The Nucleus Caudalis DREZ procedure is a minimally invasive procedure and, while safe in expert hands, does have potential rare and infrequent risks including infection, weakness, balance problems, usually temporary, rarely permanent, cerebrospinal fluid leaks, difficulty with speech or swallowing, stroke, or hemorrhage, all very rare. Temporary postoperative changes in sensation can be seen with clumsiness or difficulty with arm or leg positioning as the balance fibers are directly overlying the trigeminal nucleus. All of these symptoms are usually transient and improve over the first couple of weeks. In large studies, long-term pain relief has been reported in up to 60 to 90% of medically refractory patients.